Welcome to my world, another day, another period, another time for knowledge acquisition. Knowledge is power, health is wealth. Today's topic is early detection of colon cancer. Colorectal cancer is highly devastating and ranked as next to the lung cancer. You may say it's the third if you want to put the liver cancer ahead of it. But the problem is, how do we detect it? We all know that this colorectal cancer is a problem that probably has to do with aging. Yes, as we age, our body becomes less perfect. The usual practice is for body to remove any cell, any damaged cell out of the system, really totally removing it. But the effectiveness of this process becomes a problem that will now result in accumulation of these cells that becomes tumor cells. You see majority of these as polyps along the colon, and that eventually would translate to cancer. Let's move on into the slide section. If you like my presentation, please press the like button, subscribe, and be sure that more of this quality production will come your way. The outline. One, objective. Two, introduction. Three, signs and symptoms, cancer stages. The fifth is early detection and laboratory diagnosis. Prevention is number 6, and finally conclusion. The objective: to create more awareness on colorectal cancer and also expose the need for early diagnosis in order to reduce the prevalence of colorectal cancer. The introduction: cancers generally are the major societal, public health and economic problem in the 21st century, responsible for almost 1 in 6 deaths and 1 in 4 deaths of that percentage from non-communicable diseases worldwide. Diseases causes 3 in 10 global premature death from NCDs, and it is among the 3 leading causes of death in this age group in 177 countries out of 183 countries, according to the IARC. Lung cancer was the most frequently diagnosed cancer in 2022, responsible for almost 2.5 million new cases, or 1 in 8 cancer worldwide. The next followed by cancer of female breast, then colorectal cancer, and so on, prostate and stomach cancer. Colorectal cancers can be traced back to DNA mutation that turns off tumor suppressor genes or turn on oncogenes. Genes help tumor cells grow and survive. That's the opposing gene to the mutation gene. The problem I had earlier expressed that cancer is just a problem affecting the DNA. The development of the colon cancer usually requires changes in multiple genes. It has also been traced to the P57 gene. You can see the P aspect in that shape, spindle shape of the chromosome. The smaller part, up part, is the P aspect of the chromosome, where the gene chromosome P57 lies, and other predisposing conditions like ulcerative colitis, Crohn's disease. Among the environmental factors are high intake of meat and low, as found by E.Q. Achabunk. Signs and symptoms. The symptom is what the patient can see, whereas the signs are what manifest to the doctor very well. Colorectal cancers and polyps are frequently asymptomatic, so as a patient you may not even notice, especially early in their progression. When symptoms do emerge, they often show up as changes in bowel habits,
constipation, diarrhea. You just find out at times you are constipated, or it could present as diarrhea, or a feeling the bowel is not empty. There is blood in stool, pain in the abdomen, along with aches or cramps that don't resolve on their own. Unexplained weight loss, iron deficiencies, with or without anemia. That's the sign that the doctor will see, and has been found to be the most frequent hematological manifestation in patients with cancers generally, particularly a colorectal cancer. Cancer stages. Generally, cancer generally has stages known to the clinician. The tumor can be graded on its histological differentiation into grades 1 to 4 by the Duke's classification. Stage A, it is limited to the bowel wall alone. At stage B, it spreads to tissues outside the bowel wall, but not to regional lymph nodes. The treatment around this period is just to excise the areas affected, the regional lymph node and the subsection of the colon. Stage C, it shows growth in the regional lymph nodes, so it's not some part. And D, it shows distant metastasis to the lung, liver, and the organs. So at that stage, the kind of treatment is dependent on the doctor, chemotherapy, and what have you, to see about. At every stage, you can predict the lifespan. Probably stage A, it could be 5, probably maximum of 10 years. At the stage D, it's just close to death. Yes, laboratory diagnosis. The early detection has to do with the sign and symptoms, coupled with some laboratory markers tests, apart from the age factor of 45 to 75 years, which is a very important risk factor, because as we age, the body has really come down, where it is not as effective, it's not as efficient in disposing of dead cells. Damaged cells, the body usually remove it. That's what is called apoptosis, and you find that it is done perfectly without any inflammatory response or anything happening. But as we grow in age, these genes probably are lacking or not as effective, because everything that happens is as a result of the genetic makeup of the person producing these proteins that will perform this different function. But when they are not performing effectively again, the dead cells will now pile up and create the tumor or polyps, which can become cancerous with more effect. That is the mutation of the genetic makeup, and if it is hereditary. Once it is hereditary, the lab could be of great help if the person presents his stool, because the blood may not be seen with the physical eye, but it could be discovered using a certain test called occult test, stool-based fecal occult blood test, or fecal immunochemical test, and that can be done every year. A stool single DNA test every 1 to 3 years is also another possibility. Or the biopsy sample of the polyps is examined to know whether it has become cancerous, or flexible sigmoidoscopy every 5 years, and or the colonography, or especially colonoscopy, can be done every 5 years. These, once one starts aging, and you can really start suspecting that since this cancer is very common, you probably the risk factors are so common, prevalent with your lifestyle. That is, if your lifestyle encourages all this, shows this risk factor, then it could encourage the triggering of the cancer. Yes, prevention is better than cure. Since colon cancer has been linked to low level of physical activity, frequent meal intake, low fiber diet, low level of dietary calcium, and low beta-carotene intake, then prevention is just to do the opposite of what is linked to: regular physical exercises, lower frequency of meal, not overloading yourself, taking high fiber diets that will help to hasten the digestion and not overload the digestive system. Increase reasonably your dietary calcium, because calcium itself is indicated as dangerous when it's too high. Increase beta-carotene intake, vitamins. Overall, about 90% of colorectal cancers are caused by environmental exposure, such as low fiber, that's in the environment, and high fatty food. Alcohol consumption is very indicative because it affects the DNA, and tobacco as well. The tobacco smoking is the one that is more effective on the DNA. Yeah, finally, the rest by conclusion. Colon cancer from this exposition is preventable, and if you have become more enlightened, it's very good. Though the polyps may not be seen early enough, thereby delaying the laboratory diagnosis that will prompt the clinician to collect a biopsy sample for histological investigation to confirm if it is cancerous before it starts metastasizing. The patient history of his family, known to the patient himself or herself, that is having probably the first cousin experiencing something like that, then you should be an alarm for such a person to do regular examination, especially when aged between 45 upward. Should also be helpful in colonoscopy examination for tumor. If you like my presentation and you like what I'm doing, there are so many videos on my channel, as Akinola-Anjou channel, that you are on, and you can watch more. So many of it, over 100 videos recorded. I'm sure it's close to 150 now. So please encourage yourself to watch more of my video. Subscribe to make it even be more rewarding. Thank you.